Hello, everyone. We have people logging in, so we'll give them just a minute or two to get settled, and then we'll get started. All right. Welcome, everyone. Thank you so much for joining the Link Center for this shared learning group focused on the topic of sparking systems change and the importance of partnerships. I'm going to go over a few housekeeping items while we get started. The session is being recorded, and the recording and the transcript will be made available on our website. We welcome you to revisit the content yourself and share it with others. Attendees cannot see the names of other attendees, and all attendees are muted. Please do use the chat function in Zoom to communicate with other attendees and with the host during the webinar. You can use chat by clicking on chat at the bottom of your screen. And do be aware that your name will appear in the chat if you make a comment. And you can change your display name by clicking those three dots next to your name and selecting rename. We will have representatives from the Link Center watching the chat and responding throughout the session today. If you'd like to submit a question or a comment privately to the host and panelists, you can do that by clicking on the Q&A function at the bottom of your screen. We have live captioning and ASL interpreters present today. We will be spotlighting the active speaker and the ASL interpreter throughout the webinar. If you click on View on your Zoom screen, you can change the way you see the panelists. And if you're having any trouble with your view, you can let us know that in the Q&A and we'll try to help. So at this time, I'm going to hand the floor over to Dr. Stacy Nonamaker, who's going to start today's presentation. Stacy, it is all yours.
Thanks so much, Stephanie. Hello, welcome everyone. So glad to be here with you all today. We're very excited to be talking about sparking systems change and the importance of partnership today. So we'll just go ahead and get started. For those of you who don't know about the Link Center, hopefully most of you do know about the Link Center. Really curious how you got here, and you may have come through our website, but we have a QR code and a link to our Link Center website up on your screen. We love to tell people, come check us out and check back often, because we're constantly vetting resources and information to put up on our website, as well as news, and just things that really support the mission of the Link Center, which is to improve mental health access for people with disabilities. So about the shared learning groups, and I don't know how many of you are repeat attendees, but we host 4 meetings per quarter. We do one for direct support professionals like this one. Later today, we'll be doing another shared learning group for clinical professionals. And then tomorrow we do one for people with lived experience and families of people with lived experience. The information and the topic and essentially the content is the same across all of the shared learning groups. We may tweak the talking points or the exercises for the specific audience. But again, across today and tomorrow, we'll be talking about sparking systems change. So this presentation is a collaborative among the Link Center partners, of which there are many, and you'll meet some of our partners today, which I'm very excited about. The Link Center partners include people with lived experience, researchers, and others who work on policy issues. As Stephanie mentioned, and bears repeating, we will record and transcribe today's meeting. That means we'll be capturing all the words that people say. Any of the materials that we share will be available after the meeting, and we always encourage you all to share far and wide. So some of the goals and outcomes of today, what we will do is we're going to share some of our thinking and what we're doing at the Link Center related to systems change. And specifically, our partners will talk about the impact of storytelling and partnering with others on creating systems change. We'll provide some resources, and then we will engage you all in a little exercise to help us solve an example situation, just to hear from you how you're thinking about this topic. That's the shared part of the shared learning group, right? As part of the Link Center, we have a really amazing group of people who make up our steering committee who help us do a lot of things, including develop content for these shared learning groups. And one of the things that they've done in the almost, I guess, 2 years now that we've been doing these shared learning groups is develop some agreements or some foundation for our time together. So I'm going to share those with you now to really set the stage. The first is take care of yourself. Do what is necessary for your comfort and care. We should be gentle with ourselves and each other because this work is hard to do. We celebrate that we are all individuals from different backgrounds. We celebrate that we have shared experiences to learn from. And we know that we are each unique with our own experiences in the world. We listen and share with open minds and kindness. We do not judge or blame others for what they share. So, talking about today's topic around sparking systems change, and how can we do that with others? We really think that the Link Center and all of our partners that you see up on the screen are a really good illustration or example of this. And we just want to share some things that we've already done or have instigated as part of the Link Center work. The first is we have engaged with 988 Suicide Lifeline Crisis Call Center administrators who oversee the state call centers to really influence their intake processes. So when people call in, counselors take some information but still maintain anonymity with the caller. And what we have shared through our steering committee, lived experience stories of our partners and steering committee is that there really needs to be a better way for the counselor to understand the needs of the caller while also maintaining that anonymity. And one of the things that a couple 988 call centers in the western part of the United States are trying out is asking questions like, what do I need to know about you to better support you? Right? So that's really incredible if you think about it, right? It should give the counselor some more robust information about the caller and should, still maintain the anonymity of the caller, which is the intent of that intake process. A second thing that we're doing is we're pulling together emergency room doctors, nurses, we're pulling together psychiatric pharmacists to hear from them about transitions for people with co-occurring conditions from the hospital to the community or from an acute setting to the community. Because we've heard loud and clear from people that these transitions are often very complicated, are very cumbersome. So we're hoping through this focus group, we'll get some insight from the other side of this two-handed clap, if you will, of what really is happening during those transition processes. And then finally, another example is that we noticed in really looking out into the world and seeing what's available in terms of resources that there were some gaps in resources for people with lived experience around things like trauma and crisis. We'll drop a couple of those examples of things that have been developed by the partners related to trauma and crisis in the chat so that you can see some of the things that we've been developed. But again, another plug here for you to go to our website and check out some of those resources, some that we've identified, embedded, and some that we have developed. Now, I mentioned the steering committee. I'm having some trouble. Oh, there we go. I mentioned the steering committee and their role in the Link Center. And really, they're a great example of influencing systems from the perspective of people with lived experience. So these are people who inform all we do at the Link Center. For example, topics for these shared learning groups, content for shared learning groups, and including today's topic. And some of the things that the steering committee shared about the topic of sparking systems change as they have had to navigate systems is that they feel that there's a need to educate systems. There's a need to make systems less complicated, especially these service systems. They talk about needing to understand how to advocate for themselves within different systems. The steering committee has also talked about the need to ensure that all people in a system feel heard. So these people on our steering committee for the Link Center talk about feeling stronger in their mission of creating better access to mental health together, working together, meeting together. And some folks have even reported that being part of this group has also strengthened their sense of self and what they need. Let me just give you a quick example before I turn it over to my colleagues from one of the steering committee members. Her name's Alicia, and she talks about using art as a form or her way of communication. And what you see on the screen is an example that she has shared with us that she used to encourage lawmakers in her state to see the importance of the direct support professional's role as they make decisions about wages in her state. So just some examples that we want to share as it connects to the Link Center and the work that we're doing to incite and spark systems change. So now we'll get into some more content and some good perspectives and ideas. And I'm going to turn it over to our colleagues, Agnes and Barb, to talk more about how we each have a part in changing systems, focusing on stories and storytelling. So Agnes, I'll turn it over to you. Thanks so much.
Thank you very much, Stacy. So good morning, good afternoon, in whatever time zone you are in. I am Agnes Atakai. I am Diné Navajo. I grew up on the Navajo Reservation, and I am the program manager for Native Initiatives with the Sonoran Center for Excellence in Disabilities. And my colleague is Barbara Brent, and she's our Community Systems Change Liaison. So both of us will be presenting today on behalf of the Sonoran Center for Excellence in Disabilities. So we are one of 68 university centers on disabilities. And so we facilitate the flow of disability-related information between community and universities. We work with people with disabilities, members of their community, state and local government agencies, and community providers in projects that provide training, technical assistance, service research, and information sharing, with a focus on building the capacity of communities to sustain all their residents. And so, again, thank you very much for allowing us to share with you Creating Ripples, Stories for Change. And I am a 50-ish year old woman with dark graying hair, a tan skin, and reading glasses. And so I will start our presentation. Next slide, please. Before we start on talking about stories for change, we have here on the screen an image of what is called storytelling dolls. And these are also called worry dolls, and they are used in different Latino communities such as Mexico and Guatemala. The legend says that children tell their stories or worries to the dolls before bed, then place them under their pillows, and the dolls take the worries away while they sleep, allowing for a peaceful night's rest. The dolls may also be used as a tool for storytelling by weaving ideas, situations, and people into a story. For indigenous communities, such as the Pueblo communities, sometimes we have story dolls that are made out of clay. And many times, folks also develop other dolls, and these are passed down to family members that carry down cultural narratives, myths, and teachings. So these dolls symbolize that story connects people through generations. It connects knowledge, culture, traditions, and ways of knowing. So, in essence, storytelling is an important role within human culture. And usually, all over the world, people tell stories about and include their values, traditions, experience, and actions. And so, storytelling is a powerful way to make change in our community. So, next slide, please. So, in today's topic, we are going to talk about storytelling. And so, we'll be sharing ideas, examples of how storytelling can be a positive tool personally with those close to you and to foster systems change. As author and speaker Brene Brown states, stories are data with a soul. Also, an Indigenous scholar by the name of Dr. Brian Brayboy, in one of his theories in Indigenous literature, talks about stories as also data in theory. So stories are very powerful. And so in learning communities, we usually have objectives to guide how we are focusing on today's topic. And so, again, to reiterate, we'll talk about how storytelling can be an effective tool to nurture self expression, foster self knowledge, and drive self determination. Individual and community storytelling is used to support people with lived experiences to drive meaningful change, and storytelling will provide storytelling examples and ideas for sharing one's own lived experiences. So let us start. Next slide, please. And I will hand this over to my colleague, Barb.
Yeah, thank you, Agnes. One of what we wanted to start about is what is a system? I actually wrote down the Oxford Dictionary definition of a system. It's not very friendly. It's a set of things working together as parts of a mechanism or set of principles according to which something is done. So I'm not sure that gets us where we want to be when we're talking about human service systems. For people lived experience, families, providers, and people in the government, we usually think of the system of a thing, right? It's the big thing that has funding, rules, regulations, and you've all experienced, and we've had the opportunity to listen to some of you talk about how the formal systems can feel really unapproachable and overwhelming. And navigation, especially when somebody has support needs that are both for people with developmental disabilities and those with behavioral health support needs, can be even more confusing and intimidating. One of the things that we try to focus on in partnership is to think about it from the other side. A system really is just a building or remote people, people that are striving to do their best within resources, within law, and with the parameters that they have that are able to help you. They get frustrated too. So if we could start with a level playing field that assumes goodwill from everybody, that should foster partnership and bring people together to talk. Um, Next slide, please. So, as we talked about, systems are made up of people. Everybody has experience, struggles, and hopefully lots of hope and accomplishments. So, we've changed the definition to be a group of individuals, families, advocates, providers, government groups, and community members striving to share their resources, knowledge, and power to improve the quality of life for people. And with that, one of the things that must be very difficult depending on what side of the desk you're on, but for people with lived experience in their families, how many times do you have to share your story? How many times do you have to share your story differently to qualify for one system and share your story differently and change some of the paperwork to be able to qualify for another system? And then how in the world is it somebody with lived experience's job to have the two systems connect with each other, along with medical and any other support need that you have? So it can go in a circle. And what we hope to bring to you today are some examples about people working together with those frustrations, with those accomplishments, and including not just having people at the table, but engaging people with lived experience and family members. Change can happen. There are examples, there are some things we wouldn't do again, and many things we would. And next slide, please. So systems and storytelling all are related. And as Stacy talked about early on, is that we all have the power to make change, whether it is change within ourselves, whether it's supporting other people on their journey, or assisting a larger group of people with their support needs. If you're part of the larger DDD or mental health systems, I just use an acronym. I'm sorry. I'll put a quarter in the bad box for doing that. What we found is that peer support, offering to speak with agencies, walking with someone through intake as to why all this stuff is being asked, and intentionally bringing people to committees, coming together at the beginning of policy changes, not to look at a draft that's almost done with a review period, but to actually be at the ground level, learn about each other, appreciate each other across all different parts of whatever as we call a human service system. There is where we found new ideas, creativity, and common ground. And Michael Small talked about respect, trust, and partnership, and that's the goal. How do people get there? You can read all the files that you want. You can read journals, you can read different magazines, you can read policies, but it's not as strong as when somebody with lived experience and or their family tell their story of what the policies look like on the ground every day, when it works and when it doesn't. So stories can bring us all together for better understanding, for better caring, and for trust. And next slide, please. And so to continue with that, one of the things that we've noted is as we get more comfortable, even as professionals or whatever our role is, it fosters change. There's a reflection when you start talking yourself about a story, an experience, no matter where you are as part of the system, you gain self-understanding. And it's a new way for partners to listen. We can have all the spreadsheets and data we talked about before, but what we hope to do is build connections and be a springboard for systems change. That is something that we do together, and it changes the power differential, which means it's easier to talk about all of us as being equals in the room, equals on earth, and equals in storytelling and systems together. So next slide, please. So that's Bill. And Bill is, I've known him a long time. He's always friendly and outgoing, but he lives in very rural Arizona. And if you're not familiar with Arizona, you can drive 11 hours without traffic and still be in the state. And you can be in places in a good part of the Navajo Nation that Agnes can talk about. There may not be phones, internet, and people need satellite phones if they can afford it. Bill, just this bubbly, if you knew him now, this bubbly, happy person. There weren't services available, and special ed usually meant he was pulled out for an hour about how he could do better with his work. He is bilingual, but very hard to understand unless you truly learn to listen. In the words of our beloved Herb Lovett. So the children around him was a small enough community that he didn't get bullied much, but he felt very alone and withdrew because people didn't know what he was saying. One thing, or many things Bill had going for him, was he and his mom both have very high expectations for themselves and for others. So he began to feel more confident, and he said, I'll dive in. He started volunteering for all these different sports. Well, he doesn't play sports, but he was part of being there and helping others. He was helping in middle school with children that were younger than him. He's still a very active volunteer. He began to build confidence and share his story with others. And as the trust built, they shared their stories, and his circle grew wider and wider and wider. People found out he had talents that he never talked about because he wasn't very comfortable talking. Uh, they found out he was really good at math and really good at video recording. So he got snapped up by a volunteer self-advocacy association, which it calls itself. I know that we use different words for self-advocacy. And they asked him to volunteer to make videos of other people telling their stories. Bill shares his, they shares theirs, and they use those videotape stories for different planning sessions to have other people understand them and for any way that makes a person feel good about the story they choose to tell, not the story told about them. He's paid now. He only volunteered so long. He got assertive and talked about that. And he is a very strong peer mentor. And we can see it. He works with a lot of people that are bilingual so that it is sometimes more comfortable as people are together sharing and learning. And next slide, please. I'd like to turn it back over to my colleague and partner, Agnes. Thank you very much.
Thank you, Barb. As we heard in the previous story and slide of Bill and his impact and the ripples that he's created through his stories. So storytelling connects. So our individual stories, it begins at birth and it ripples through life. When we are born, our parents tell us stories, tell us who we are, and later on we start learning to tell our stories. And these personal stories really create personal agency, which means that it creates power for us. It connects us to another person's story, as Bill who has shared his story, and it creates that ripple effect that impacts people. So again, we have an image here of a child who puts their hand in water, and ripples are created. And that is the impact that we have. These ripples go across the lake and possibly connects with other ripples and makes unique, distinctive patterns. So my story is, as I said, I am Dine. I am from the Navajo Nation. And in our language, there is no word for disability. And growing up, I've had several family members with physical disabilities, and we accepted them, didn't know that they had disabilities because they still interacted and were valued members of our family, and they were respected for their gifts and abilities. And later on in life, I actually developed a visual and cognitive disability due to a primary brain tumor, which impacted again my ability to see. I developed a couple of detached retinas and some challenges in remembering and thinking sometimes. And most of the time, I've lived with this for over, I'd say, 20 years and really never shared my story. It was not until I started working with the Sonoran Center and was tasked with developing webinars for our center. So the first webinar I did was on traumatic brain injuries and my story of disabilities. So I hyphenated and put DIS hyphenated and abilities because I wasn't sure if I had a disability. And so in talking and developing the webinar and telling my story, I came to realize that I did have a disability and that in telling my story of being diagnosed and the challenges and going through a treatment and getting services to help me to regain balance, to be able to use tools to remember and navigate. Um, Afterwards, I had several people reach out by email and by phone who were very happy to hear about my story and shared that it really connected them because they felt like they did not have a disability because it was not such a visible disability, but it was not for folks considered disability. And so sharing my story really opened up my ability to tell my story and to be comfortable with it and to share and also inspire others. Next slide, please. And so as we see in our what we shared so far, Barb has provided some examples of how we can use our stories for personal support and advocacy. We saw at the very beginning a photo or a painting of using art as a form of communication to encourage lawmakers to see how budgets are helping, or hindering services to people. We can also use it for planning, as was mentioned in our earlier stories, of including members with lived experiences on planning committees at the very beginning to get our stories, to get our concerns, to be able to be included and not as an afterthought. And being included in helping to identify or share or highlight our voice really builds trust, and we find a common understanding when we're working in groups and sharing our stories. So really, stories to share the stories are that are important to us is really important, and it needs to be part of any kind of planning processes to really identify what those community strengths are, some of the challenges, and some of the needs. And in the work I've done with in public health, the communities have the answers. Academics and people who work in universities may have the theories and interventions and connections and how to write policies, but it's really people, the strengths of the people that really fuel the data for how policy, how research should be implemented. So next slide, please. So again, as what Barb had reiterated, that storytelling can improve how people receive services and supports. And so Barb was going to cover these next couple of slides. Barb?
Thanks, Agnes. We all know about those system touch points to be able to receive supports and services to have a good life in the community. Sometimes they feel hot to the touch, and sometimes it feels kind of prickly. It can be positive or negative. There's always something that has to do with intake. There's always something about, gee, am I approved? There's always something about, well, what supports can I get based on what I need and what I want? Then there's implementation and how it's going. And then there's moving forward because we don't want to do the same thing forever. So in each of those touch points, people have stories that are positive or stories that are negative. Sometimes we may hear more negative because when you're navigating between two major systems, if you have co-occurring support needs, it amplifies or makes bigger each one of those touch points, and it might get prickly. We're from Arizona, so there's some cactus references. So what can a state do about that? Or as direct support professionals, what can you do sitting down with your provider agency? Having focus groups with people with lived experience and families share what works, what doesn't work, what actually happened versus what was intended to happen. Walk a person and a group all the way through when someone with lived experience began their journey and where they are now. It's illuminating, and it takes a little of the tension or anger out of the room because it's a story. It's not accusatory. It is what it is, with hope, trust, and partnership for change. So the next slide, please. So storytelling can actually improve services and supports. We can have a lot of data. You probably have a lot of clipboards about you. If you're working in the field, you're probably using a lot of computers to take notes. Sometimes you're sharing that with people with lived experience in the family, sometimes not intentional. It's the business of our day. But we have had an ability to have intake change. And some of that is pure support. Someone who walks with the person through the intake person can be paid, can be a volunteer. It's however somebody can have someone to walk beside you that's been there. We all need that, whether we have a certain label or not. Nobody wants to be alone and invisible through these processes. Sometimes it's not simple, but it's just saying, okay, this is why they're asking for the information. This is what the legal pieces are. This is how you gather the documents, and then check in to see how things are going. Sometimes knowing why, even if it's not a fun process, can be helpful rather than why do they keep asking these questions and I've done this over and over. We've also seen some good success on service planning. When someone is asked to share their story, not the story somebody tells about them, with their own history, preferences, and what makes a good day, what would make a good life in the community, it's powerful before people start planning for the person with lived experience or their family. Doing this makes it more that a team is planning together. And as you heard about with Bill, sending a video story, photos, or even storyboards before a planning meeting can be a real game changer in what happens in a service planning system. And walking out, knowing somebody better, and hearing that story. And again, it's the story they want to tell about their future. And next slide, please. Briefly, let's talk about Lexi. Lexi is a person with a developmental disability, still in school and hitting those really fun years we've all had called transition. The summer work program at our Sonoran Center tends to look at very inclusive opportunities for summer employment. But in this particular case, Lexi was so shy and so nervous, she got a job at St. Vincent's thrift store. It began to build her confidence. And what people found out is that doing her job, the task of her job, was really easy. It was socializing with customers, with coworkers that began to stop her from looking at a future in a different job. She met so many people. She became a regular. They're regular customers too. And everyone encouraged her to share her story, again, a story she wanted to tell about what she wants in her life. Well, a year later, or I guess it's 3 months, it was a summer program. She was so enthusiastic. She began telling a lot of people her story that are in her circle about she wants to help people, perhaps be in this field, and plans to go to University of Arizona. Her story had power. Her story was much more than a person that was in a somewhat sheltered setting, afraid to talk. And with that, next slide, please. A couple other notions about how storytelling can improve services and supports and how they have is implementing. So if a person with lived experience shares stories of what went well or not in any given day, in any given week, in any given situation they've been in, it adds a level of understanding and builds empathy. May not happen in your state, but there are times where people have a hard time reaching new heights. If you have this job, yay, you have a job. You're in a stable situation, your counselor's been with you for a while, you're doing well with your medication, and you've got some friends. Yay. Let's now move on to the next crisis. Some planning teams may think. But through stories, you can learn people's aspirations, hopes, and dreams. We don't all want to do the same thing for the rest of our lives. And by telling those kinds of stories and feeling less timid about saying what you want, self-confidence and learning more is something that we've seen very strong. So what can the system, however we want to define the system, those that have some level of ability to make change, focus groups have helped. Funding family to family groups. There are many states, and a lot of them are peer mentors on navigation and what to do if you're stuck. And peer-to-peer information of people with lived experience is really helpful. Sometimes there's grant dollars to do this, and if they can be found, it is worth every penny sometimes not. Some of the volunteer efforts still make a difference. By walking in the shoes with someone, change can happen. And next slide. I'm going to turn it over to my colleague Agnes, and thank you very much.
So we've seen so far examples of stories of resilience. And resilience is defined as our ability to adapt to challenges, and how these stories can be combined with community challenges, needs, and create positive change. So next slide, please. So I'm going to share with you an example from our Sonoran Center for Excellence in Disabilities. One of the focus that we have is working with Indigenous Native American communities within Arizona. So we do partner with several organizations and community members to host an annual Indigenous Youth Disability Summit. This year was our 5th annual that happened on April 12th, 2025. And so, as part of the planning process, we had Indigenous youth from Diversability Incorporated participate in planning of the virtual summit that we have. And as a result of their ability to be part of the planning process, they focused on the agenda of having stories from their own personal experiences be two of the major panels during our virtual summit. So the two panels that they identified and participated and shared their stories on were one, transition journey to independence stories, um, stories of how they transitioned into employment, into adulting. The next panel was intergenerational impact stories, identifying people who in their community helped them um, as elders, as community members, as peers, who helped them and how their impact really helped them adjust maybe to life or to find goals and purpose. So with each of these individuals we have here on the screen, 5 young people from various indigenous communities in Arizona representing the Gila River Indian community, Salt River, Pima Maricopa, and other indigenous tribes. So each of their stories was unique, just like a drop of water, and each drop creating a unique ripple that is shared with people on the virtual summit. And then these ripples join and make waves, and out of their presentations, there was common themes of culture as importance to young people, as young people finding their ways, finding their voice, having support from community, sharing of stories that help them identify their needs. So this is one example from our center of how we've been able to use stories as identified by youth in helping to educate and to help us identify some program planning needs. Next slide, please. So why do stories matter? And this is an infographic that we are able to utilize, and it has multicolored sections with examples and icons. So the first one is that stories are universal. Stories help us understand our place in the world. Stories help us learn how to act wisely. Stories help shape our perspective of the world. Stories help us understand other people and their perspectives, and stories pass down knowledge and morals. And as we've seen this as played out in this previous slide of the Indigenous youth and their panels. Next slide, please. So stories create community. So why do we work alongside people with disabilities? It's because we are peers, we help support people. We also, as teams, can create stories, and these stories help provide the vision and purpose of our organizations. It influences fundraising, advocacy, partnerships. And so these are the visions that we create as a team. And as I said before, the ripples come together and create unique patterns, just like the image we have here on the slide of the many drops of water creating distinctive patterns depending upon how heavy the water droplet is, or if we use a stone, how heavy it is, how fast, how hard we throw it. And these ripples help create unique patterns. So how do we do this? And so, as Barb mentioned earlier, providing examples, we honor stories during intake and programming and in research. We are able to use those stories to help identify our goals and our objectives, our research interventions, are the ways that we can create um, processes better. We can also help to coach to support people telling their stories. Sharing a personal story is very challenging. As my story exemplified, it took me quite a while, 20 years of after being diagnosed, to actually start telling my story of visual and cognitive impairments because I thought for one that would impact my ability to be employable, sharing too much information in the workplace, and I did not want people to see me as someone who was not capable. But the reverse was opposite. That I was able to support others who were going through the same process. What we can also do is host a platform to share stories to foster a sense of belonging. So once we have these stories, what do? We can have platforms that provide a place where people can share their stories. I have here as an example from the Administration for Community Living has a website and dedicated page to stories of disability employment journeys. And right here's the link. We're not going to go to the link, but this is just to share with you that there are places on the web where people tell their stories to share. And I'll share other examples as well. Next slide, please. So we have here an example of Jerry. Mm, Jerry was hit by a drunk driver at age 18, resulting in a traumatic brain injury. It was okay at He was okay at rehab, but after that, he stayed with his mom and dad for months. Jerry became lonely, bored, and depressed. Counseling was okay, but didn't provide any tools for action. And he sometimes got tired of talking. So he came to a counselor's office early one day and saw some flyers for a peer to peer support group. Again, reluctantly he joined. Maybe he was hesitant, but like listening to his peers' stories and how they're sharing information, and he started sharing his own. And it became clear to the group Jerry was skilled at speaking. And then, because of his ability to speak, he was able to go to DC to take part in a national traumatic brain injury conference. And he described it as a turning point, as turning the light on, and that he can help peers and peers can help him. So he actually became a peer for people with new lived experiences with TBI and rehabilitation. Again, many times we all have experiences of not being sure of how to tell stories, our own personal stories, but participating in a peer-to-peer group really helps us in helping to find our skills. Next slide, please. So we also have another example of storytelling as a tool for change. Here we have a photo of Alicia Manuel, a colleague of mine who works with Native foster youth. And in her story, she talks about her advocacy starting from becoming a foster mom. And she became a foster mom of 3 kids and focused on Native children. She was nominated for a CNN Hero Award. And her journey from prospective parent to becoming an auntie to hundreds of foster children here in Arizona started with a tiny baby, a borrowed car seat, and a onesie. That was the tagline from the story from ArizonaCentral.com, which is one of our online newspapers. And that was a tagline, and that hooked a lot of people. That she talks about how a tiny baby, borrowed car seat, and a onesie started off her journey to being a foster mom. So in her story, she talks about her story of being a foster mom, about working with Native youth, many times with various abilities and disabilities, and finding sources of peer support, culture, and connection to community because they are hungry to have a community. Um, so again, that one line of a story can hook you into a cause. Next slide, please. And in our Sonoran Center for Excellence, we do utilize print materials as form of story. So we have several items here on our screen of examples of materials created, future planning, a roadmap, our future wishes. We have my interests, hopes, and dreams, an exploration tool and guide to my personal preferences. And again, these are workbooks. Again, think of these as journals that where people can put their stories and interests in there. So when we want to create stories, how do we do that? We decide on what we want to create. We look at who is the audience. We listen. We allow people to share their stories. We are patient because many times people are uncomfortable sharing their story. And also, we provide examples of stories to start people to let them know that there are folks with lived experiences. And then we learn how to create stories. We develop a platform to share stories. And we remember that stories are waves, they're audible waves, they're visual waves, they're photos and pictures. And they can be written like journals, poems, and workbooks, as these examples are on the screen are shared with you. Next slide, please. And again, we do have another example of positive parenting. We have Pregnancy and Parenting Support Project between parents with disabilities and their needs and preferences. And so here is a link. We're not going to provide you the video, but if you want to listen to Francine's story as an example of one project we created in documenting parenting and present pregnancy stories, here is the link. Next slide, please. And so we talk about digital storytelling, which combines oral and written storytelling with images, sound, and video. So in my work within the University of Arizona, I've been here for 25 years. I worked in the College of Public Health first. And one of the projects I worked on was creating digital stories, excuse me, for communities to tell their story. And we trained community members first to write what their story is. What do they want to tell their community that was happening, that was so important? And so we coach people to write down their stories, to practice reading out loud to see how others hear it. Is it understandable? Is there a hook? Is there something that can bring people in so that you can be engaged in it? And taking photos of their story and putting it together in a computer software. So back at the time we used iMovie on Mac computers, but also used free software that was available on Microsoft Systems as well. And so we had success in creating several stories for our communities that focused on impacts of testing on the health of communities and cancer, on injury prevention, car crashes, and how that impacted community, on community gardens and how those were very a good way to increase nutrition, especially among preschool children, and of course, how communities tell their own stories of how culture is important to them. Next slide, please. So again, as I said, the creating of digital stories is person with experience, lived experience, become the authors and directors and they decide on what and how they want their story presented. And then we as supporters, as I myself, um, help them develop their stories using the video software, but it is storyteller led and owned. So that's an example of some of the work I did in creating digital stories. Now, next slide, please. So we wanted to share with you that people can create their own stories. Now, how do we do this? All of us have phones. Many of us do have phones, cell phones. And of course, there's Facebook, Instagram, TikTok. And there are ways that you can create stories on Facebook. There's a link on YouTube on how to create one, how to share stories on Instagrams. That's where a lot of our younger generation have been developing stories and advocating and for maybe policy change or to highlight something that is of interest. For those folks who want to use print, Canva is a free online graphic design tool that you can use to create documents with stories. They have a lot of templates that you can use. It's very user friendly and intuitive. You can also record stories on StoryCorps. StoryCorps actually has a disability visibility project, an online community dedicated to creating, sharing, and amplifying disability media and culture. So there is a um, link to that particular resource. And so there's various ways that we can use to create stories. These are just some resources here that you can utilize, and there are many more. Again, it would be as service providers, you can connect with consultants. You can connect with students who are very savvy in utilizing this format. You can go online and find resources in how to create these stories. Again, stories are very useful in um, looking at community challenges, identifying some of the needs, and creating change. And it's giving power and agency to people with lived experiences to be able to change the way that we can improve how we receive services and supports, whether it's intake, whether it's being on planning committees, developing, again, as Barb and others have said before, how we can be part of planning committees and identifying goals and objectives, how we can provide that substance for research projects. And so, next slide, please. So I'd like to thank you very much for allowing us this time to share with you some of our stories, both Barb and I, with the Sonoran Center for Excellence in Disabilities. Our work, again, is to create linkages between universities and communities. And I know we have 2 minutes left, but we'll transition and turn over to our colleagues Max and Wendy for the upcoming group exercise that you will be participating in. So again, thank you very much for allowing us the time to share our stories.
All right. Well, great presentation part. Thank you very much. So I'm here with Carly Winnie. And what we're going to be doing is, first of all, I'm Max. I am glad to be presenting to you all today, and we're going to be leading a group discussion prompt. And so what we're going to do is I'm going to read the scenario, and then your job as the audience is to come up with answers on how to solve the situation within the scenario. And feel free to put it in chat, but also if you really feel like it, I have no problem with having you, kind of put yourself off mute and just say what it is out loud, your answer to the solving the scenario. But again, this is just a way for us to really get your thoughts, because I'm one of those individuals who likes to learn from the people that I present to, and this is one way of doing that. Before I move on, though, would you like to just say a little quick introduction, Carly, for people who probably didn't?
Absolutely. My name is Carly Winnie. I'm the Chief Operating Officer here at NAD, and I am a middle-aged white woman with graying hair wearing reading glasses, and I'm very happy to be here today and supporting Max with this group exercise.
Thank you so much. And I forgot to say that I am a black man with uh, black hair, and I'm wearing a white. Uh, I'm wearing a white collared, like nice collared dress shirt with like thin light blue stripes and a black tie. And so wanted to make sure that I got that description in there for anybody who is has difficulty with seeing. Um, Alrighty, so without further ado, we are going to go into the scenario. And again, your job is to come up with answers in chat, or you can put yourself off mute and just say them out loud. We will definitely be keeping an eye on your answers, but here we go. So, Raul is 32 years old and has been attending a clubhouse in his city that focuses on people with mental health support needs. There are activities like cooking classes, art classes, budgeting classes, and bingo. Raul very much likes to go to the clubhouse for something to do and to be around other people when his family is at work or doing their own thing. Raul also has autism and feels that the staff and members do not understand him and the other people who drop in who also have a cognitive disability. For example, he gets overstimulated easily, especially when there are a lot of people at the clubhouse and it becomes noisy. This is when Raul will have trouble talking to other people because he is distracted, or he will go off by himself and rock. He is usually a social guy and engaged in the activities, so others seem confused by this. So, how can you encourage Raul to share his story to spark change for others at the clubhouse to understand people with co-occurring conditions? And who else could Raul partner with to spark change?
So again, anybody, feel free to type your answers in the chat, or if you would feel comfortable speaking, you can raise your hand and we will unmute you so that you can share your thoughts.
Justin Wallace says in the chat, I would probably see if Raul would be interested in creating a video about what he likes about the clubhouse and the challenges he faces. I would like to see him share this with the leaders of the clubhouse.
Great idea. Amy Boone said, start with asking Raul what he's comfortable sharing with others. That's a great point. Great way to start.
Michelle Castile, if I'm saying that right, says he would help others like himself and obtain a voice.
Justin
Yes.
Wallace said maybe he could include ways to address the challenges he and others might face so that they have ideas on how to help.
Kathleen Geddes says perhaps Raul can approach one of the staff members he feels a connection with, and that may help him begin to establish.
Kathleen also says sometimes it's taking baby steps.
Mm-hmm. Amy Boone says the clubhouse could also focus on sharing information about a variety of disabilities and points of view so that it's not just Raul. Michelle says the more he learns about himself, the better he would be able to express his needs.
And Lindsay Sloan said on a practical note, creating flashcards to show people when he is overwhelmed that state what is wrong and what others can do to help.
Justin says that's a good idea, Lindsay, and pretty simple to start.
Absolutely.
Michelle says, or a medical ID bracelet. Nancy Button says Raul could identify others experiencing some of the same emotions and partner or buddy up with them so they can support each other. That's a good idea.
Yeah.
Amy Boone says, I think it's helpful for stories to share not just challenges, but also positive experiences. Oh, yeah. Camille he says, I think it would be good to discuss with Raul if he be comfortable sharing tips with staff and or the clubhouse, and if so, in which format would be most comfortable for him to do so. As someone who is also autistic, a written format might be appealing as it could feel less stressful than face-to-face discussion, for example. Michelle Castle's peer support would be ideal as well.
Great suggestions.
Uh,
Amy Boone said if he partnered with a staff person, they could each present examples of supports they rely on from others. So it's not just Raul asking for support.
Jay Kraus says a discussion on the perspective of the other people at the clubhouse could be helpful, helping Raul to see that people at the clubhouse may not understand his experience/disability and that they cannot understand it without him sharing his experience. Nice. Anybody else?
All right, I think maybe that's it.
I Again, if there's no one else, I know sometimes there's sometimes last minute or last second or last half second um people that may pop something in, just like after you put all the kernels in the popcorn machine and they all pop, there may be those one or two that haven't popped yet, and then they just come up randomly after you unplug the machine and stop it. Empathy is an important skill and consideration for all, says Amy Moon.
Absolutely.
Asking the club, this is Jennifer Harris, asking the clubhouse to be mindful of volume before he goes up to share his story will help him to not feel distracted from the noise and creating a situation where he wants to flee. These participants have terrific ideas, says
Yeah.
Barbara Brent.
They do.
Nice. Vishad Frink says also Raul can partner with people with disabilities to spark change and create a team of change.
Stacy says, I love the idea of considering peer support. The peer mentor could learn about and become a change agent for how the clubhouse can be the most positive experience for all. Absolutely.
Justin Wallace says, good idea, Vishad. I was thinking Raul could approach a local group that could help educate the clubhouse.
Yeah, I think that's an important point too, that it shouldn't all fall on Raul to be the one to provide the education.
I don't believe that there's anything else that I see. I guess all of the popcorn kernels got popped. All
All
right.
right.
Well, thank you, everybody. And I think I am going to turn it now over to Becky.
I believe so.
All right.
Thank you all for your input.
Thank you so much.
Thank
Becky, the floor is yours.
All right. Thank you, Max and Carly. I love the popcorn analogy. I'm going to use that one for sure in the future. Well, I wanted to just take a few minutes. My name is Becky Wolfkiel. I am the Executive Director of the National Association of State Head Injury Administrators and a proud Link Center partner. And I'll be closing the presentation today. What a wonderful presentation by Barbara. It really got, I think, all of us thinking, and it helped me think about the importance of our Link Center Steering Committee that was mentioned earlier in the presentation, and the important role that they play and their stories play to help incite forward momentum and progress through this center and beyond. So I think we can all find connections with Barbara's message today, and we'll continue to be thinking about this message moving along. So as we at the Link Center continue to develop content that is meaningful for you, we're hoping that you could just drop in the chat for us some of the resources and websites or trainings that
you utilize regularly that you think are particularly helpful. If you wouldn't mind adding that to the chat, we would love to take a look at it and use it to continue to inform the resources that we're developing at the Link Center. So please do help us by doing that. And then in the meantime, we'll move over to the next slide, please. Thank you. So here's a schedule of the past and upcoming shared learning groups like the one today. You can find the recordings and transcripts from past events on our Link Center website, and you can register for upcoming shared learning groups there as well. The next topic will be on the importance of relationships in October, which I am personally excited about. I think that's a very important topic for us to dig into as the Link Center. If you could go to the next slide, please. You can visit the website at the link below, and we're going to drop it in the chat as well, if that might make it easier for you. There are a lot of really wonderful resources that we've been crowdsourcing and placing on the website. If you know of any that you think we should consider, please do let us know. Next slide, please. And we do have a quick evaluation for you that we hope you'll help us continue to provide content that's meaningful for you. So please do fill out the evaluation. You can use this QR code that is up on the screen now. And we'll also put a link in the chat for you. It will pop up when we close out today, and everyone will also receive that in your email. So really appreciate you just taking a few minutes to fill that survey out. It will be incredibly helpful for us, and we will use that feedback as we continue to develop these shared learning groups. Next slide, please. I want to again just thank the Link Center Steering Committee. They really are the force that drives all of the work that happens through the Link Center. Humongous thank you to the Sonoran Center, a really wonderful presentation today, and all of the Link Center partners. Thank you for your contributions and support of the center, and for helping us prepare all of the content for this meeting. I think that concludes our presentation today. Here is the contact information if you would like to reach out to the Sonoran Center for any additional information. I know they would love to hear from you. And big thanks from all of us at the Link Center. We look forward to seeing you at future shared learning group sessions. Thanks so much.